Hello everyone, my name is Olufunso Odunukan. I'm one of the fifths on the go here at the 2015 ACC Scientific Sessions. With me today is Dr. David Newby from Edinburgh, Scotland. He's one of the authors on a late-breaking trial. And welcome, Dr. Newby. Can you tell us what your trial is all about after you introduce yourself?
Sure. So I'm David Newby, a cardiologist from Edinburgh, Scotland, and our trial is about computed tomography, coronary angiography in the chest pain setting, and particularly in cardiology clinics for patients with suspected angina due to coronary heart disease.
Excellent. Can you summarize for us the results of the trial?
Sure. So what we did is we took 4,000 patients who presented to the clinic, and we randomized them one-to-one to have a CT coronary angiogram or no CT coronary angiogram. And then we followed up to see what happened. And what we found was that the CT coronary angiogram changed the diagnosis in about 1 in 4 people. That led to a change in subsequent investigations in 1 in 6. And ultimately, the treatments changed in 1 in 4. So treatments were stopped and or started depending on how the diagnosis was changed. It didn't change, interestingly, invasive coronary angiography that much. There was a slight early rise, but subsequently were the same in the two groups. But we did see a trend for more coronary revascularization, and ultimately, actually, we did see a reduction in the rates of fatal and non-fatal myocardial infarction of around 38%.
Wow, that's an excellent trial. How long was the follow-up period?
Yeah, so the study started in 2010, and it completed a recruitment back in September. So we have follow-up ranging between a few months all the way through to 4 years. So the average length of follow-up was 1.7 years, 20 months.
And how did this affect mortality?
So mortality was overall low, but you have to remember that these patients, only a quarter of them actually had obstructive coronary disease. So the people coming to the clinic, over half of them had normal coronary arteries or near normal coronary arteries. So they're not going to have a heart attack, and their event rate's going to be very low. So overall, the event rate in the trial was around 2 to 3% over 1.7 years. But obviously, if you were that accounts for probably only a third of the population who are at risk. So overall, you're talking of event rates considerably higher for those that do actually have coronary heart disease. Excellent.
How do you envisage this will change clinical practice?
Well, I think my take-home message, is that I think if you've got someone and you're not clear on the diagnosis with whether they have angina due to coronary heart disease, a CT coronary angiogram is the best way of just telling the patient whether they do or do not have coronary heart disease. It really makes the diagnosis clear. And for patients, they want to know, do I have coronary heart disease or don't I have coronary heart disease? They don't want, well, I don't think you have, or the probability of you having it is low. They want a straight answer. And CT coronary angiography certainly gives you a straight answer when it comes to not having coronary disease. And I think with actually modern technology and modern scanners, you can actually tell quite quickly and reliably whether they actually have obstructive disease, as indeed our trial shows.
What are the cost implications of this?
Well, it's a one-off test. Of course, it's the consequences of it. And it did stop some medical treatments, and it started some medical treatments. And I think overall the cost on medication is probably neutral. But I would also say the benefit there is that you're stopping treatment in people who'd otherwise get treatment for life for no good reason. So that's a real cost benefit. As I said, coronary angiography didn't change, but of course coronary revascularization did appear to go up a little bit, and of course that's not cheap. But the test itself, of course, is relatively cheap. I don't know how much it is in the US, but in the UK it would be £200, $300. So a very simple, cheap test.
Well, thank you very much for joining us, Dr. Newby. It's been a pleasure having you on the Fit on the Go program.
Thank you very much. It's lovely to be here in sunny California.
Thank you very much. And to see more videos like this, please go on to www.youtube.com/fitsonthego.